A lot of complications that arise from inappropriate renal dosing aren't really recognized as inappropriate renal dosing. Here's an example. We had a patient recently who came to the ER. She was an 84-year-old woman who lived home alone with moderate dementia. She was still able to manage her activities of daily living, kind of manage her medications, etc. She was brought to the ER confused and delirious. What the ER missed was that she was receiving digoxin 0.125 daily, but for a woman her age with her level of renal impairment, she was digoxin toxic. So her presenting symptom was confusion and aggression. So what did they do? They gave her another medication for the confusion and the aggression, which landed her in the ICU. And we got the call that she was in the ER, and we said, don't touch her, we'll be there in 15 minutes. And by the time we got there, she was intubated and in the ICU. That whole expensive hospital stay could have been avoided with appropriate renal adjustment of her digoxin in the first place. When we discharged her, and she got through this episode with some damage to her cognition because of the confusion and the ICU stay, we discharged her on 0.125 milligrams every other day, whereas she was on 0.125 daily.